I see everybody's here. Any disclosures? Seeing none. Evelyn, you.
So I just wanted to provide some clarification for members of the public who may be watching. As the Council of Haldimand County, always in cases of emergency have the opportunity to call an emergency council meeting. And in the case of the COVID-19 pandemic, it is deemed necessary to convene this meeting. Our procedural bylaw speaks to it specifically, and it's very clear that that no business other than the actual emergency is dealt with. So we have a brief agenda here, and it's been set out for members of council. And Mayor Hewitt, I'll just hand it back to you.
Okay, well, with that, I'll...
Your Worship, a question from...
Sure, Councillor Corbett.
I notice a bylaw we're about to pass. Is it just for this particular pandemic, or does that carry on? Or do we have to, after we go through this, repeal the bylaw?
So just to clarify, the items that are on the agenda for the meeting today are a verbal update on the COVID-19 pandemic. Then there's going to be a motion about scheduling of meetings. There is no other bylaw to be passed here, and I think staff will speak to that matter. The bylaw that's listed on the agenda is just a confirming bylaw.
Thank you. My concern was that if we pass that bylaw and this is over, does it carry forward, meaning that we've given authority, which I don't mind, to our senior officials to sign bylaws, etc.?
And so there is no authority being delegated to any staff to enact any bylaws. That's not feasible under the Municipal Act.
Thank you for that clarification.
Okay, great.
So with us today, we have the medical officer of health for Haldimand Norfolk, and he graciously agreed to come and provide council with an update of the COVID-19 situation as it relates to our two counties, as well as perhaps providing some information in terms of the steps we're taking to deal with it. So with that, Dr. Shanker, go ahead.
So, Mayor, members of council, usually I'm addressing the Board of Health, so I was going to call you Chair of the Board of Health. But,
No, don't do that.
I was on the phone with the board chair as well, so she's well aware. Thank you for allowing me this opportunity to speak today. The first and most important message is that there is no reason to have unnecessary angst about COVID-19. It is an item of concern, but there's no reason to have unnecessary angst. So if I could provide some context, the vast majority of people with COVID who get COVID-19 ultimately get better, and most of them get better with treatment at home. So the typical person who presents with COVID-19 will have respiratory symptoms: cough, runny nose, a fever, shortness of breath, chills. And if you were to take 1,000 people with COVID-19, probably 800 or 900 would probably be able to be treated at home. And they would get better and they would continue with their lives. A smaller group of people, recognizing the numbers are fuzzy, but a smaller group of people would be required to go to the hospital, and most of those people would be evaluated and sent home with home treatment. And then a smaller percentage of those people would be admitted to the hospital, and a small percentage of those people would ultimately succumb to their disease. Now, what is the exact percentage of the people who might succumb or die from COVID-19? Perhaps 1 to 3, 1 to 4, 1 to 5%. It's a small but significant number, and we have to be cognizant of how we can help those small people, the percentage of people that are vulnerable. The people who are likely to experience the worst effects of COVID-19 are the elderly and those people with multiple medical problems. So when you take the overall risk, in the counties of Haldeman and the counties of Haldeman and Norfolk, the risk is low. The risk is never zero, but at the current time, based on what we know, the risk is low. The second thing to think about is that the reason we closed the schools or extended March break and the county independently, the Board of Health independently closed, or in concert with the province, closed daycare centers and other athletic facilities and places where young people congregate. Why was that? It was because we wanted not the children to be safe, because the children, if they get it, they're going to be better. They'll have a respiratory illness and they'll get better. The issue is that children can communicate the illness to their parents, and from their parents it can travel to their grandparents and other community members, and then we'll have community spread. So by closing the schools for 21 days, we'll have a chance to minimize the spread to the broader community, which is a good goal. The goal at this point is to diminish community spread, and I'll talk about that in a minute. But one thing to think about is there is a response in Haldeman and Norfolk counties. I have met, and the health department, we have met with hospitals and hospital leaders, members and leaders in the community center. I've spoken to many physicians, paramedic, fire, ambulance, county officials. We've all met to formulate a plan, and I was at a meeting earlier today. That wasn't the first meeting. So I think we have a reasonable response to addressing this issue. What happens today? What happens today if a person has respiratory symptoms, a cough, a fever, shortness of breath? We ask them to call their family doctor. And when they call their family doctor, the family doctor will take some questions. If in fact that they're a person if they're a person at risk for COVID-19, which is they have to have symptoms and a history of travel outside of Canada in the last 14 days, if they have both, then we put those people as people who need to be investigated, and we put them on quarantine or self-isolation. They should stay at home for 14 days. That'll keep them safe, and they'll keep everyone else safe. And at the same time, we try to organize a test for a COVID-19 in the community in an organized way. We make an appointment, they go to the appointment. Now, that is already happening. That is already happening, and it's happening quietly, because one of the things about the Public Health Service is we want to work in the background. So that's already happening. People are getting their calls answered, they're getting their questions answered, they're getting the testing, they're being put on self-quarantine. The vast majority of people in self-quarantine accept it. They're not happy about it, but they accept that this is the right thing to do. The results up to this point is we've fielded, and I don't have the exact numbers, we've fielded many hundreds of calls. I would estimate today we're up to probably 400 calls or around there. And we've put perhaps more than 100 people on self-isolation. We've tested, my guess is 30, 40, 50 people. The numbers grow. And there's not a single documented case of COVID-19 from that testing. So up to this point, we've been okay in this county, and okay in Norfolk County, and okay in Haldeman County, in trying to contain the number of cases. So what's next? And I think that's the next issue. What's next? What more can we act on? The thing that we have to think about is, and this is a public health term, social distancing. COVID-19 is primarily or substantively transmitted by respiratory droplets. So not only do you have to have the virus growing in you, but you also have to have a way of transmitting it to somebody else. So if I had COVID-19 and I coughed on my colleague here, I would project it to him. I'm well. But I would project it, and he might get a chance of getting sick. So we have to try to minimize the transmission from one person to another. If you're 6 feet apart from somebody else, you're not likely to give them COVID-19. Secondly, so social distancing, one is in everyday activities that we try to keep a distance from other people. The second item is that we want to try to get people to work from home. If they have the opportunity to work from home, they should work from home. I have asked employers to give people the opportunity to work from home. Thirdly, if you have the opportunity to spend March break with your kids, the extended March break, do it. It's a valuable thing. And if that means 3 more weeks with your kids, that's a good thing, independent of all those other things. That spend the time with your kids. If you don't have a reason to leave the house, don't leave the house. That doesn't mean don't socially interact with people. There's a million ways to interact with other people than going to their house. This is the most important thing. And I really want all of us to talk about this. I talked to my mother about this. For people that are 20, 30, 40, 50, even if they get COVID-13, they're going to have it's going to be like any other respiratory illness. It isn't fun. If you're 70, 75, 80, it can be a real problem. You can end up being admitted to the hospital. Small group of people end up on a ventilator. Those are the people that are most likely to suffer. If you have, at the county level and at the public health level, we have stopped and we have advocated for that elderly people who live in residential housing, nursing homes, retirement homes, don't visit. Interact with them, of course interact with them, don't visit. Because what might be a mild infection to you could be something very serious to an older person. Secondly, there are 20,000 older people in the counties of Haldimand and Norfolk, people over 70. The vast majority actually live in their homes. And so I've told my mother this, stay home. If you need your groceries, order them online. If you can't get them online, my wife or I, or we'll find a way to get them dropped off at the house. If you don't need to go out of the house, don't go out of the house. If there's something that you need for medical treatment, you can put it off. You can put it off unless it's urgent medical treatment. So social distancing and self-isolation or reducing the number of interactions is worthwhile. What can other people do? If you're going to the shopping, if you're groceries every day, every 3 days, go every week. If you're going grocery shopping, try to go at times which is not so busy. We've already, and I hate to use the word canceled, but we've asked people, and we've postponed a lot of group activities where there are more than 50 people. So with that, I think that we'll be able to achieve social distancing. But my core message today is, one, do your best to protect the elderly, the old and the disabled, and that we can all do. And the second part is, if you don't have to leave the house, don't leave the house unless there's a compelling reason to leave the house. With that, I hope that the number of cases starts to flatten out a bit. Now, what else are we doing at the level? Hospitals are planning, and they're planning with county officials and other partners, paramedics and I don't know all the perfect modern names, but there are a lot of people, the fire, the police, ambulance, doctors. We're all working to manage the surge in capacity in patients. I anticipate, and I hope that I'm wrong. I really do hope that I'm wrong, but I'd sooner be prepared and say we overreacted than we underreacted. So we're prepared to support the hospitals to provide capacity so if there are more patients who need hospital beds, that we can provide other types of service models outside the hospital. So we're working on that now. I know Haldimand County is working on that, Norfolk County is working on that, the Public Health Service is working on that with them. So that is the other item. In closing, and I'm happy to answer any questions, the most important thing is to think of this in perspective. You know, I'm 53. I wasn't involved in World War I or World War II or the Korean War, but somehow the country got through that. In my lifetime as a doctor, I lived through the HIV crisis. Remember the AIDS crisis? I lived through it. I lived through H1N1. I lived through SARS, and we'll get through this one as well. We just have to marshal the resources. As a doctor, I would say that there's no reason to have unnecessary angst. We do have to put the resources, though, to manage this problem. And I think that we have a good plan in Haldimand County and a good plan in Norfolk County. So with that, thank you so much.
Councilor Lawrence?
Thanks, Doc. That's a lot of good information there, and even though watching the TV, that's still giving us as much more that we need. With regard to mobile testing centers, is there going to be set up? I know we do have a center set up in Delhi, as I believe.
Yeah.
Or,
So if I could comment on that. The most important thing in medicine is not to be tested. The most important medicine for any disease is to get well. So it doesn't matter if you get tested and you die or get sick. It matters that you are generically, that you're getting the right treatment. So that's the first goal. There is an organized program to test people. It's an organized, functioning program. So if you have the right symptoms and you have a travel history, we will do our very, very best to test you, and we have people on a scheduled time to get tested. I expect more than one place to open up. There is one place going right now, and I'm hopeful that that we'll get some sites sponsored by the hospitals. If you're in quarantine and the testing, right now, if you call today, you might be tested, let's say Friday, right? But you're safe today, because now that you're on quarantine, self-isolation, you're safe today. And you, more than likely, will get better. So if there is a possibility that, that your testing date may exceed when you're going to be released from quarantine. So that's also a good thing. So if someone said, I went to Florida 7 days ago, I had a cough, they called us, I'd say, well, self-quarantine. And then I'd say, and we're going to book an appointment for you. And if that appointment ends up being after your 7 days, well, then it's not, you would not, that's good. That's a good thing, right? It doesn't mean, so I think that testing, and this is something that's really important when you see in the media, the throngs of people presenting to testing centers, that's not a good strategy. The second item, and this is something is that remember that most of the people who are, at least in this district, who actually are tested, they're all negative. So they don't have COVID-19, and they're going to get better because they have other respiratory pathogens or respiratory diseases. If you're really sick, independent of testing, you still have to go to the hospital, and you need to be seen. So if you're so short of breath that you feel sick, then those people are going to the hospital. And on occasion, people call the hotline. We say, well, you can't stay home. You got to go to the hospital. And then they'll go to the hospital and get evaluated. To my knowledge, no one in that situation has actually been admitted to the hospital. So that's a good thing too. I don't know, I could speak about this forever, but I hope that answers your question. Testing sites are already open. There's a way to get them. They go through the Public Health Service. I expect more testing sites to open, but testing is not the most important thing. I hope I was clear about that. Yeah.
You're good, and I guess in relation to that, building on that, is that what you said, quarantine for 14 days with self-isolation is the best thing because there is no vaccine anyways.
That's right. Well, this is not, so I'm going to speak boldly. One of the greatest advantages of being a doctor is that many diseases get better on their own. As doctors, we take credit for people getting better, but many illnesses get better if they saw you or they didn't. And when I first graduated, I used to work as a family doctor, and I'd be like, "Oh man, I'm going to miss the diagnosis." And an older doctor said, "Look, most of these people get better even if they didn't see you." So you always got to take that in context. Many viral illnesses we don't have specific treatments for. It doesn't mean we can't care for them. So if you have a viral illness, and we can make you feel better, if you have a temperature, we can help suppress that. If you have a cough, we can suppress that. But many times, the body itself eradicates the illness. Not always, but many times that is the case. So yeah, and it's too late for the vaccine, right? I don't see a vaccine coming out in this COVID season. This may be the new normal. Maybe we have influenza earlier on, and then we have the second type of illness. So there are a lot of illnesses that are more likely in the winter than in the summer. We don't know that just yet. Part of the reason we're putting a lot of energy in is we don't know, right? But when you look, there are lots of viral infections that people might have. I hope that answers your question. I ramble sometimes, so you can cut me off.
No, thank you.
So I got Councillor Metcalf.
Just a concern if I'm out with a lot of contact with the elderly myself, but not having any symptoms, but I'm just trying to figure out, the testing sites, I'm showing no signs or anything, but should I still be cautious dealing with the elderly?
Yeah, so it's always a risk-benefit decision, right? So I think that if it's something that can be postponed for a month or 6 weeks, I would postpone it. I've canceled my clinics. I treat a lot of elderly people, but most of my patients are chronically ill, and they come to see me because they need their prescription renewed, or they want some reassurance. I'm going over a lab test. So now I would just tell them on the phone, or I would speak. So I have changed my own practice, recognizing that's disruptive to patients. So if they need a real estate appraisal or a visit from their insurance broker, maybe they can do that on the phone. The one thing I would say is that older individuals are pretty tech savvy. My mom emails me, right? My mom is, I'm not going to tell you her age, but I do get the emails from her, and she'll say, why haven't you emailed me back? So I think that we can use other methods to provide services to people without necessarily being in contact with them. On the other hand, there are certain services that are absolutely essential, and we should not stop, interacting and meeting with them for those items.
Counselor Shurton and Counselor Corbett.
Yeah, thanks. So, appreciate you being here today. I'm kind of a math guy, so when I hear your symptoms are roughly 7 days, and if they're quarantined, why is there such a concern it could last for months? Is it because there's certain people could be carriers without symptoms, and people might, or is it because of all the uncertainty? Because I think there's a lot of hype about this, and I do understand there is risk for a few, but it's kind of baffling how much we've shut people's lives right out right now.
Right. So, math is, I have a graduate degree in quantitative methods, so I've followed the numbers too. First of all, the amount of media time spent on this relative to the risk is disproportionate for sure. 4,500 people died of opioids last year, and I've never seen the National spend an hour on the opioid crisis. Right? So we've had 5 deaths. It's not to say that it's not important. So I think that the proportionality and the distortion or the misstatement it's troubling. But it's obviously, I'm concerned, and I'm here because we're concerned, and I am concerned about the older individuals succumbing to the illness. And we know that in Washington State, 6 elderly people, I think it was 6, died in one nursing home. And I think there were a number in BC who died in one nursing home. So it's good to be, it's good to be cautious, but. And I am cautious. I'm cautious when I give my son the keys to my car, right? Aren't we all? I never sleep until he's home. That's the thing we all face in our families. We are taking assertive action that's inconveniencing children, and my children are inconvenienced because my kid's college is canceled. I can't see my daughter in Puerto Rico. We're taking assertive action to inconvenience children and adults so that we can diminish the chances of the old and the very old suffering adversely. Secondly, we know that the number of cases are increasing quite significantly, and that's the reason that we're taking these very assertive actions. The number of actual identified cases is doubling every 2 to 3 days. That in itself, that's just one piece of data, but when you have a large number of people who could be potentially infected, then even a small number of people who suffer the adverse consequences becomes a big number. And that's the math of it all. Sure. I wish that we would, and I agree, I think that sometimes the messaging is so over the top. If I could digress a bit, one of the things I have learned, I'm a doctor, I'm a 1990 graduate, so this is my 30th year of practice. I learned something which I did, and it was actually a Haldeman County official who shared that with me, that their children are receiving message from media and sources that I don't receive from. Like, I don't, the telephone doesn't tell me what my news source is. I read the paper or watch TV. It is important for children. I think in the two counties are, I think, about 20,000 children. They're people under the age of 18. That we really have to have a measured message for them. They get messaging that's just so extreme about the number of people that potentially could be suffering. I think that it is obviously worth sharing with children. This is something concerning. We've obviously changed our practices. We've caused some level of disruption, but it is not anything for unnecessary angst. And I think it's worth having that, rational dialogue with them. The number, and I may have repeated myself, the number of people who died in a motor vehicle crash in Haldeman and Norfolk County is about 20 every year. The number of people who died in a suicide is probably about the same. And the number of people on average who died in the opioid crisis is more than crashes, so I would put that probably 30, 35, recognizing the data is not perfect. And no one has died of COVID-19 in Haldeman and Norfolk County, and up to this point, no one has tested positive. That's the risk set. Now, it may change, like all groups of data, but if you have to ask it from a mathematical point of view, that's where it's at. I hope that answers your question,
No,
Councillor.
that's good, thanks.
Okay.
Councilor Corbett?
Yeah, thank you. I've got a number of questions that might seem trivial to everybody, but there are questions out there.
I'm happy you're asking me trivial questions. Most of your questions are so hard I have to get back to you.
With regard to places where gyms and everything, is a local gym such as a group fitness center to be considered in the act that's being put out? Like if I lift weights at some place, is that considered a place that should be shut down?
Yeah, so the Premier, I think in his directive today, asked places of that nature to discontinue operations. So to the extent that the Premier the Premier is our Premier, and if that's what he directs, I think we have to follow it. I'd like to follow, though, we try to make the best rational decision we can based on the data that we have. So in a large group setting, it's the number of people, it's also the age of the people, and where they're coming from. So I got one call where they said that they were going to have a party for a senior who's going to hit his third digit. And there were going to be visitors from overseas. And I said, I got to just tell you, on the face of it, a whole group of elderly people with a whole bundle of overseas visitors, you shouldn't run, that's not a good idea. So the number that I would use otherwise, first, if the Premier says it, we have to do it. Otherwise, 50 is the number, and I would use some judgment and determination of that. So before the Premier put forth his directive, we sent an order saying 50 is the number for restaurants. But so is the risk of an athletic facility with mostly healthy people right then and there high? The answer is no. If one of them is sick and they give it to another person and they go home to their home where there's their grandmother, that becomes a different story. So I think that's why the Premier had wanted to do this. One is only infected, the period of infectivity, meaning between the time that you picked it up and the time that you can give it to somebody else, we think at the outer end is 14 days. That's why we chose 14 days. That's the science behind it. It's probably a little bit less, but we don't want to take a chance on that.
I'm taking it from your response that I should tell this person that falls within the Premier's order.
That's right.
With regard to restaurants, and I just got the information, they say the restaurant is open and they're delivering food and taking orders, but the chairs are still up there. Similarly, the restaurant's closed, but you can do this. You can't serve food in the restaurant.
Well, that's right. So following the Premier's directive, first of all, the vast majority of people are trying to do the right thing. In the time that I've been here, even when it was a difficult thing for the restaurant owners, they want to do the right thing. I've only had a few times where they don't want to do the right thing. So I think they all would want to do the, it's not the number of chairs, it's the number of it's actually the restaurant under the province's directive has to serve people in a takeout format. So they come, they can get their food. I would ask them to stay 6 feet apart and get their food, pay their bill, and take it out. And I think that would be.
Thank you. And the mayor mentioned something about testing stations. Do you have, I'm reading into what you're saying, essentially you have to be referred to a testing station?
Yeah, if you meet the criterion, which is if you have respiratory symptoms and have been overseas or out of the country in the last 14 days, then you will be scheduled for testing. So long as we have testing resources, and we have enough right now, we will test you, and that's.
And who is the referral person? Your doctor?
Well, the first person always, and the reason I say this is really important, many people have respiratory symptoms and they do not have COVID-19. I was just on the phone with, I won't tell you what profession they are, but I was talking to this person. I was like, you don't have respiratory disease, you got something else going on. So just because you complain of shortness of breath doesn't mean that you have an infectious respiratory disease. There are a lot of other things, and you may need to go to the hospital right away, and a doctor would know that. If they, if you had a collapsed lung, don't call the public health service. Your doctor will say, go directly to the emergency department. So we don't want people to suffer because of this. So first, go to your family doctor. First, call your family doctor. Don't go to them. Call them, because they only take appointments now by the call in advance. Call your family doctor. Family doctor will make a few inquiry questions. If they think you're at risk, they'll tell you to go on self-isolation, and then they'll give you the number of the public health service. We answer our phones every day, and then we'll get the story. If we think that you're someone who's at risk, we will organize the test for you, and you'll get it in a scheduled, organized way that you'll be able to get your test. And and if you're in a high-risk group, you may still need to continue on with quarantine because the test is not perfect. So I'll give you an example. If you came from northern Italy on a plane and you had a cough and you had a fever, those people are at high risk. And even if their test was negative, we would probably continue to quarantine them for the full 14 days because tests aren't perfect. And that's what I was trying to get to, is the test is not the most important thing. The most important thing is that you're safe and the patients are healthy. So I don't know if that answers your question.
That's fine. I just want to follow up on that because Kathy gave us some information.
Counselor, I need a drink of water,
Give us some information. There's a nurse throughout the province that's working 24/7 that if you call, you get some guidance from. Then a lot of people will say, we don't have family doctors and we can't get in touch with them.
So if someone doesn't have a family doctor, first of all, if you have a family doctor, call your family doctor. If you call the health unit, if you don't have a family, if there are people who don't have a family doctor, I have some suggestions. I'd sooner do that privately with you if you know those people. But the health unit will also take the calls. So if somebody says, I don't have a family doctor, I have a cough or a fever or shortness of breath, and I traveled to Florida and I came back in the last day or so, and you don't have a family doctor, you can call telehealth. If telehealth telehealth is not answering, if you call the health unit, we'll do that inquiry and we'll try to provide that help. We have 6 people working on answering phone calls, but I don't want to skip, and the reason I talk about family doctors are the cornerstone of health services. And the last thing we want is people who don't have the total spectrum of care. A family doctor is also an excellent resource. They can screen better than any one of us because they know the patients, right? They're their patients. If I phoned my family doctor, he would know me better than someone you just got on the telephone. So that's the reason I'm emphasizing family doctor.
In your discussion with the hospitals, do they see the ERs overwhelmed as a result of this? Or what should you be telling somebody?
If you're sick for any reason, you should want to go to the emergency department. If you're sick and you think you're a person who might have COVID-19, you should call in advance. Like if you think you're going to die or it's something so bad, you're feeling so sick, go to the emergency department. That's what it's for. If, on the other hand, you feel like you can manage this at home, it's like any other flu, the question I would ask is this like any other flu that you've had? Because probably that's what it is, but accounting that we don't have any cases, then I would say call your family doctor and go through that other process. I think the emergency departments are doing well. I don't think they're, I haven't spoken to the medical directors, the medical director of the Norfolk General, and I haven't spoken to hospital executives about that today, but I think they are providing access. One of the reasons we have community testing centers is it allows them not to have to address the health needs of people who are just there for a test. So if I could give another example, if you have chest pain, getting an EKG makes sense, right? You got to go to the hospital. But if you just want to get an EKG because you just want to know, that's not a good reason to go to the emergency department. You know, go to your family doctor. Family doctor can assess your level of risk, and if you're appropriate, they'll do an EKG on you.
Thank you. A lot of people are calling with regard to compensation programs such as, do I receive reduction in hydro? I realize that's not our area, but do we have numbers that we shuffle off for them on? Compensation packages, and you spoke to some of the employers about those.
I want everyone to know, this is where the questions get, I don't know.
And that's fair.
All kidding aside, here's what I think. That's not an area that the Public Health Service can comment as experts on, because I don't know enough about social services. But listening to the Prime Minister today, it seems that there are some mechanisms that are available for people who are disadvantaged. If I could comment more seriously, I am concerned, and we are the public health concerned about people who can't or who are financially challenged and perhaps can't, it'd be more difficult for them to have a delivery service or eat food that might be canned. I don't know if I went to buy for my own family last week. I went to buy some canned soup. I didn't realize how expensive it was. I don't usually do the grocery shopping in those. So we are concerned about the financial impacts. The Public Health Service and all of us involved in this are very concerned about the economic impacts and the disruption this has created to families and households. And I think public policy should try to mitigate that within reason.
Thank you. There seems to be some stigma out there in terms of whether we got a case in Haldeman, Norfolk or not.
Yeah.
What are we going to get it eventually, or?
So there was an error in one of the reporting sites. Our Public Health Service gets the results of many laboratory tests called tests of public health significance. They're sent directly to our offices at the same time or even before it goes to family doctor, just not for this, but for a whole variety of illnesses. There was an erroneous report of a case in Haldeman and Norfolk counties. That's not true. To the best of my knowledge, that is not true. There's not been a case. That being said, we're part of the broader world. We live adjacent to Buffalo. We live in counties that are close to the border, close to Toronto, and there are many cases in Toronto. I would expect that there will be a day that we get I anticipate there will be a day, if it's not this week, today or tomorrow or next week, we'll get a positive laboratory test, which will say that somebody has COVID-19 and resides in the county of Haldeman or the county of Norfolk. We will manage that like we manage every other illness. And in this particular case, if you have the disease, then you stay at home for 14 days and self-isolate. So I expect that that'll happen, and we'll manage it matter-of-factly. It shouldn't be anything that should cause us any unnecessary. It should cause us any.
So our world is not going to fall apart.
I don't believe that way. At least from my 30 years of experience, one lab test has not affected me. Yes, the answer to both is our world will continue even after the first case in Haldeman and Norfolk.
Thank you, Your Worship. People are concerned. They want to know that information. Thank you for providing it.
You're welcome.
Thanks for asking them. Any other questions? You did a wonderful job providing all the answers, and so there's not as, maybe many questions as we may have thought, but
So if I could, could I have one more minute? Would that be okay?
Sure.
So my closing message would be, first, to make our responses proportional, individually, collectively, at the government level, to the risks that we have. Secondly, our responses at the county level have been to take the most cautious approach, and some of our approaches have been maybe overly cautious, but we should take the most cautious approach. The third is visit our website, and there's lots of good information that's actually valuable on the insight, that on the website. And fourthly, as counselors, if you have questions, just call me. You have my cell phone, just call me. We try to answer every phone call that day. So if you call me, I'm happy to try to provide any assistance that we can.
just for your sakes, you don't have it in front of you, but you will be getting a document here that's going to have all of the comment steps, numbers, processes that you need to pass along to everybody that you speak to. So, Councilor Sheridan?
Yeah, I think I had somebody must be watching us live stream here. They had a question. Apparently, he deals in the public. He has an older parent who has some pneumonia. So he's concerned. He's got to go back in his public job. He's on holidays this week. He said he's tried to call public health to get a few questions answered. He's called a few times. Is there talk or is there possibilities of those hours being extended?
Yeah, we would like to extend, so, we were answering calls right through like 8 and 9 o'clock at night. So we have people at the call center, so the calls are already being answered after business hours.
Okay.
So when I left yesterday, I think if I remember, every call was answered.
So he can leave a message, is what you're saying?
Message,
Okay.
we'll get back to him. If he doesn't get his response today, have him send me his email, send the information to me, and I'll try to get someone. But typically, we have if you leave a message, people respond to the calls, because some of the calls I take, if it's from doctors, so I know that system is working. Nothing is 100%.
Yeah.
But one thing I'd say is, if you're worried about being sick, if you're worried about your life or your limb, go to the hospital. So that's the one other thing. If you think his mom is so short of breath, or call the family doctor, talk to the family doctor. But if it's life and limb, call the hospital in advance and go to the hospital.
No, I think his concern is once he goes back to work, being involved with the public, and then maybe being a carrier and taking it home to his mom. Because I think he's caring for her more and more every day. So he's seeing her every day. So that's what his question was, like maybe he should find somebody else to take care of his mom. So that's the kind of the questions that this guy had.
And those are tough questions, right? The risk is still low, right? The risk of him contracting COVID-19 is low, and the risk is still low in this county, as what we know, and the risk of them transmitting the illness, even if he gets infected during the asymptomatic period, is low. But then you have to think of what is the level of comfort, right? So, and there's no, that's a personal decision. It costs money and time and resources. If in the short period of time that his mother could live with another family member who doesn't have daily interactions with the public, that might be a personal option for them. But life is never completely risk-free. It's just the balancing the risk versus the benefits. And that is a one-off decision that every person can make. I could tell you, for me, I'm not visiting my mother, and I love my mother. We all do. But I've decided that, and I think my wife has, I think, taken the similar assertive action. That, if we don't have to make the visit, at least during this period, to minimize those interactions.
Okay, thanks.
Councilor Corbett?
Yeah, just one additional thing. I know it mentions up till March 30th. How long do you think we'll be living with this? Is there a period of time we'll be over it?
Yeah, so we get guidance that's very changed by the data that's presented every day. I would not be surprised that these assertive measures continue on Like the schools have closed, the schools, March break has been extended, I think, to April 4th. So I think there will be, there may be extensions of this period of time. Recognizing it's disruptive, but I think that it's better to be cautious in this particular situation. My feeling is any action we take right now, because there's a 10-day lag period between, or if we assume there's a 10-day lag period between if you get infected and you become symptomatic and then you become a case, that any action we take today will take at least 10 days to know what it does to the trajectory of the number of cases. So that's why I think like there's a reasonable, at least I would not be surprised if these sort of actions continue beyond March 30th.
I have one question. I haven't seen a lot of direction with respect to the home personal daycare programs. What would be the thoughts on that?
So for children, for daycare, we close, we
These
send
aren't the
an order.
sponsored, government sponsored, the private
The
daycare.
I have spoken, it's hard for us to know who they are, but they have called me. So if I could just say the process, on last Friday, we had a conference call with all licensed daycare centers, and then we told them that we'd also send them an order, because an order allows them to potentially tap into some of their business interruption insurance. So they all were supportive, but we sent that order. When I have received calls from private daycares, and we've said to spread the word out because they're a community. So for smaller daycares, I've spoken to many of them, and I know the health unit has spoken. We have said that they should close as well. The reasons are that even though you have 5 children, there are 5 high-risk individuals from not for suffering, but their kids play with each other, right? And they're 2, 3, 4. And so they can transmit to each other. Also, with the schools being out, the children of many daycare providers are already in the house as well. So they've gone up from, I think 5 is the maximum, to maybe 7 or 8. So the household has become actually close as a larger group of numbers. So, so that's the reason why. The reason for daycare is that children are born in clusters. Typically, you have kids that are 3, 5, and 7. So if you close the schools for the 5 and 7-year-old, and the 3-year-old is still in congregate activity, it's not consistent with the goal of closing schools. If you're going to close the schools, you got to close the daycare centers as well.
Well, thank you for being here. I think the message is clear. It's managing the process and not necessarily the outcomes. We know that the numbers speak for themselves, but if we can certainly manage that process, we can eliminate a lot of the concerns that people have with respect to actually contracting this virus. So,
Right. Thank you so much, and I appreciate the opportunity.
thank you.
Thanks, Doc.
So, you've got some comments? Okay, so I'll leave it with Craig.
So I'd like to just give council a sense of some of the decisions that are being taken with respect to county services in terms of our response to the COVID-19, as well as how it affects our staff. To say that the situation's fluid is probably a vast understatement. We've had a variety of announcements from health authorities over the last 2 weeks. Today, in addition to the school closures of last week, the province has enacted a state of emergency that prohibits gatherings of 50 people, closes recreation facilities, and, as was noted, restaurants and bars except for takeout food. I think it's important, though, to recognize that at this point, the province has not required a provincial shutdown or population to shelter in their home, and the vast majority of businesses that are vital to daily life, such as grocery stores and drugstores, are not affected. We've been meeting, we being your senior management team, has been meeting daily on this issue. We've had ongoing conversations with Dr. Shanker and the health unit. And as you're aware, last week we made the difficult decision to close our arenas, recreation programming, large events, and we also put things in place to protect our staff from people who were returning from hot spots. That got extended this week to anyone who was traveling outside, with the idea being that they're not to come back to work till they've self-isolated for 14 days. And as you're aware, Grandview Lodge, we're under provincial order, we're not having visitors. And I think that, all of this was done, and the decisions that were taken to, cancel Stag and Does and things like that were all done with discussion with the medical officer of health and his staff. It's really important, and he's mentioned it several times, there hasn't been a confirmed case, but on the other hand, we can't be complacent, and we do have a responsibility as an ordered government to support the federal and provincial initiatives in terms of trying to spread minimize the spread of the virus, as well as to protect our vulnerable populations. So some of the things that council can do as sort of the first point of contact is help people find the information. And so one of the things that staff has put together is some fact sheets that you can have and then post, and if you need more, we can provide it. But what it does is it will give you information that you can share on the service impacts to county services, public health information, what to do if someone's experiencing symptoms, alternatives to in-person payments, and alternative in-person services, which I'll talk about in just a second. So hopefully this piece of information will help us manage the message to our constituents in a consistent way. At the same time, and I think it's really important, is, the doctor said, and I agree, that we should not panic, that it's a situation and we're managing it. And at the same time, municipal government services, which are the services that most directly impact people, we need to continue to provide those services. We are open for business, but how we deliver service is going to change somewhat in response to the desire to ensure that we're minimizing the potential spread. So I met with the mayor today and we went through this, but in order to respond to it, and given the changes that have been announced today, in addition to the announcements that we made last week, we're going to be doing the following things. And this is really designed to promote social distancing, that whole concept of trying to avoid people from being able to transmit it to one another. So effective tomorrow, in-person services and payments at our administration building are going to be discontinued. We will continue to serve people via the phone, email, other technologies. In the package of information I've given you, there's information about how to make payments and source services alternative to in-person. And we'd like you to do what you can to help share that. Secondly, out of abundance of caution, we're going to cancel the March 31st council meeting and the April meeting. That's generally in alignment with the school closures, and I think that it's consistent with what we're seeing right across the province. Similar, the next Committee of Adjustment meeting is going to be canceled as well. We have not canceled the budget meetings between April 21st and 23rd. At this point, we're going to monitor the situation and we'll see where we're at from there. The Coffee with Council session in April, which is sort of the council outreach process, we're going to postpone that until we know a little bit more. Consistent with what you heard, we are working to ensure as many of our workers as possible can work from home, provided that they can do their work from home, and we're working on the logistics of that. So some of the things that we need to do is we need to get additional licenses that allow people to remotely work and come into our technology, as well as implement some technology. So we're going to be spending some money to do that. We're working through the logistics of that, but we're hopeful that we can implement it mostly by Thursday, so that as many people as can work from home, we'll try to make that happen. Outside workers, where there's the risk of exposure is less because you're outside, it's not a confined space, you're not near people, will largely continue as is. We need to continue to fix our roads, deal with sewer breaks, those sorts of things. Our current facilities workers, the workers that were in the arenas, are continuing to clean those facilities, and they're also doing maintenance, and so that work will continue. They can be redeployed if necessary, if and when they get done that work. Workers such as building inspectors and other technicians that need access to private property have been given a protocol to ensure that they are screening any risk before going into the property. So they're asking if people have traveled, they're asking if anyone's sick. If the answer to any of that is yes, they've been given the authority to reschedule and not do that work. Also, they've, can use their personal protective equipment in those situations. Our inside workers that need to come into the office, because not everybody can work from home and not everybody has the technology to work from home, what we're going to do is we're going to implement social distancing. So essentially, we're going to have people work at every second workstation, and we're going to restrict the number of people per floor to 50 or less, consistent with the parameters. We are continuing to offer functions for outside vendors such as tenders and contractors, construction project management, but we're taking steps to ensure that the contractors are screened and that any necessary in-person meetings are limited in size, and that we're directing them to specific locations so that they're only going into one part of the building as opposed to throughout the building. We are going to continue to promote the use of technology, video conferencing, things like that as much as possible. The construction on the we call it HCAP, the new administration buildings, going to continue. Contractors will be screened, and the intent is to do outside work while staff are in the building during the day and do inside work at night when staff are not in the building. Good news is there's not a lot more work to do, but we're going to continue to manage that. And per the advice of the doctor, all the community-owned community centers have been closed, and events on county property have been canceled at least till the end of April, and we'll monitor that. Unfortunately, that does affect a couple of the community Easter egg hunts, but again, it's one of those not wanting to concentrate people. As was alluded to, the evolving nature of this situation is such that we need to be proactive and plan on how the county can assist the healthcare agencies in a response should coronavirus infections escalate, and so the healthcare system does not get overwhelmed. And so in this regard, and in conjunction with similar actions that Norfolk County enacted, we are tomorrow activating our Emergency Operations Center. And what that does is it's a measure, it's a procedural measure that allows us for a consistent, organized, and structured approach to dealing with the planning for what happens in these situations. It allows for better administrative coordination, both internal, but more importantly, between us and external agencies. So it's simply a prudent matter to do that. And it's time, given sort of what's happening around us, to do it. But it shouldn't be seen as something that is cause for concern. So those are the steps that we're taking to try to protect our workers, try to protect the public, and try to continue to deliver service. Before I take any questions, I just also want to thank staff. A number of staff have been working significantly on this issue, including a lot of time over the weekend to deal with issues that they've come up. And that, our commitment is as soon as we know anything, if there's any changes, we'll let you know. So if there's any questions on any that I've presented, I'd be happy to take them.
Councilor Corbett?
Yeah, firstly, thanks to staff for being proactive in this response. Is this information going to be set up so it can be put online? Is it going to be on our website? So
Yeah.
if we can get it, and I can put it on FaceTime or whatever that's called.
Yeah, it's,
Our meeting on Monday for the AV training, is that going ahead?
We will follow up as soon as we have a definitive answer on
And
that.
I'm sorry, I didn't quite hear you. The next CIC meeting, is that canceled, or are we going ahead with that?
No, we're going to cancel it.
We're going ahead with it?
No, we're going to cancel it.
It's going to be canceled. All right, thank you, and we'll get information on that as well.
And just to expand on that, there is a motion that is attached to today's agenda, just directing staff to amend meeting schedules as required in response to this, so that if there are any further steps that happen, staff can make the changes that are necessarily, strictly in response to the current situation.
So I don't know whether we've got any applications at that time. They'll just be postponed without having to go out by mail again, notifying people.
With respect to the planning applications, there are some, and they've been contacted with respect to the fact that the application isn't going to be heard on the 31st, and yes, we will provide additional notice.
Thank you.
Councilor Lawrence?
Yeah, thanks, staff. Thanks, Craig, for everything. Lots to digest here. Just clear there. So all community events or use of community halls for Buckendos, whatever, we're canceling them till April 30th?
Yeah.
Yeah.
At this point in time, yeah, we're going to monitor it and certainly take our direction from the medical officer of health. I guess the message would be, based on what I heard, there's a very good likelihood it would extend beyond that.
So like when I get, say I received a call, my daughter has a Buckendo on April 23rd, it's, sorry, but postponed, let's make some arrangements in the future.
Correct.
Okay, good, thanks.
I've had the conversation with the Lions Club and Craig Peterson, so they are deferring and canceling all the,
Surprised on
yeah.
that.
Well, I think they're doing takeout, I think, or I'm not sure. I think they still allowed it. I'm not sure.
Well, I thought
No, they
they
didn't talk about it.
Yeah, I thought Craig Peterson announced today. that-
Possible, yeah. I know that the hall, because it's a similar situation as the Lifespan Center in Dunville, in that, although they are operating independently, they are still a county building, and, but whether it was connected or not, it still makes more sense for them to simply postpone those. So they've taken that direction as well. So I think notices will be going out to all of those people. So, yeah, I'd ask staff if they can get this on the website for people like Bernie and other council members to be able to transfer that information onto their local pages. I would encourage you to try to get this out to as many people as possible so that those questions are answered, and it's that process. It's ensuring that people follow the steps and that process to be able to prevent the likelihood of, the calls coming into the health unit and them being bombarded and not being able to manage those, the calls that they do need to manage. So I think we need to make sure that that message is clear. I've also asked Craig and staff to look at options and alternatives available to us as we move forward into our operating budget and completion of the budget, as well as looking for the announcements that have been currently made from both federal government and provincial government as to, what does that mean for us? There's a number of stimulus packages and financial packages that are going to be presented, and where does that sit? What does that transcend into sort of our operating and what we could possibly pass on? I know that where we can as a council, we'll be looking at making the prudent decisions that we need to make to ensure that we can operate and provide the services, but where we can also be sensitive to those that are going to experience some difficult economic times in the next number of months, that we can find ways to be sensitive to that. So that message I will be delivering to the public, that where we can and how we can, we will provide assistances in different ways. We don't know what that looks like today, but we will be fleshing that out over the next few weeks. Councillor Lawrence?
Yes, thank you, Mayor Hewitt. I think immediate concern, I think that we've all heard, at least I have, and I know you have, Mr. Mayor, is the simplifying the you want to call it the protocol for people that think they have the virus, are we setting up testing centers, or where do I go, what do I do? This most simple thing is that the good doctors said to us, call your family doctor, start there, and then move forward from there. I think we need that message immediately out on the website, because that is, it seems the most immediate concern by a lot of the Joe public.
It's very, yeah, they are going to funnel people through a number of questions and a number of processes before they actually get to testing. And I think the anticipation or expectation that people are just simply going to find out that, tomorrow we can get tested and the next day they're going to have a result, that's not reality and that's not going to happen. And so we have to deliver that message clear. So with that, I have a motion, and I need a mover and a seconder that staff be directed to amend the 2020 council meeting schedule and any local board or committee meeting schedules as required in response to the ongoing and evolving COVID-19 pandemic situation. Moved. Councillor Metcalf, seconded. Councillor Lawrence, all those in favor? That is carried unanimously. Not the only one? Or you
Yep.
got some more for
Well,
me?
these are the usual, just the confirming bylaw and
Okay.
adjournment.
Any other questions to staff, comments? No? Okay. This is moved by Councillor Corbett, seconded Councillor Shurton, that the confirming bylaw be hereby introduced, given first and second reading. All those in favor? That's carried. And it's, I need a mover and a seconder that the confirming bylaw be hereby introduced, given third and final reading, be signed by the mayor and the clerk, and corporate seal affixed thereto and numbered. Councillor Patterson, seconded Councillor Lawrence, all in favor? That is carried. So, I thought the last time we were in here, I was gonna say it was the last time. In fact, I thought that so much that I actually was at the other office, or other, council chambers.
Don't forget the retiree that you brought.
That's right, we had to bring him back out of retirement. So before I do close this meeting, I just, if there is any way possible to try to make sure that you do get the messages out as much as possible, the more you can communicate, the more that we can get that information out. We're unfortunately saddled with media that doesn't come out on a daily basis, and so it's difficult, obviously, to get that out to the members of the public. So we need everybody to sort of grab a hold of this and get as much of this information out as quick as possible.
If I may, Kyra's got it all on there now.
Perfect. So with that, I need a mover and a seconder that this meeting now adjourn at 5:11 PM. Moved by Councillor Shurton, seconded Councillor Metcalf. All in favor? That's carried unanimously.
Is there food?
Yep.
Yeah, there's food in the other room if